Welcome to Agorà, Aesthetic Medicine International Congress in Milan 2024. We are here with Dr. Cartier. So, Doctor, and which are the topics covered by you in this Congress?
First, thanks for your kind invitation. It was my first time, not in Milan, but in Agorà Congress, and I was very surprising by this Congress, very big Congress, big event, you know, as I'm scientific director of IMCAS, worldwide IMCAS, but it's always interesting to visit some friends, and Italy is very, very interesting country for aesthetic. But I would like to present today my lecture, my proposal was on ultrasonography, ecografia, because we believe, and I'm dermatologist and phlebologist, I use it since more than 30 years. I believe that in aesthetic field, we are the last specialties to use ultrasound. And I believe that it's now time to learn how to handle, how to use ultrasound in a daily practice, to prevent, to secure, to avoid any vascular compromise, to check the skin of patient if they receive some previous injections, or maybe to misdiagnose like a cyst, lipoma, so many things. So we know, and it was a discussion after my talk, the learning curve. But the learning curve is always the same. When we start to inject and to use a cannula more than 20 years ago, most of my colleagues said it's not useful, it's unnecessary. I use a needle, it's worked very well. But now it's very common to use and to mix needle and cannula. The same for ultrasound. I don't use ultrasound at any time, but I believe that in certain conditions it could be interesting. For toxin, it was very funny to explain that you can spare some unit. You are more precise, more efficient. I know that it's not really necessary for toxin, even maybe for the lower phase. For the lower ways to find the DAO, the mentally, to avoid the DLI, really, really helpful, and I encourage you to use ultrasound in this part of the face. For fillers on eco-guide procedures, it's more difficult, but we know we can put some science in the injection. It's a dynamic examination. It's a reproducible examination. It's a precise for your patient. It's not a cadaver workshop. It's not anatomic on a cadaver. You know, it's most interesting that it's your patient, and you make a mapping of your patient just close from you, and you have to explain what you are doing. And we receive so many patients now in the daily practice to check the skin below to find some previous injections, silicone, many products, and maybe also to make the follow-up. Sometimes patients come again, and I say it's unnecessary because your product is below the skin. Let time to do it. So it's unnecessary to inject again. Really, it needs university. We need the help of university, some colleagues. We are creating a task force at IMCAS to learn how to handle for our colleagues in the daily practice. But the most important is to start. The first step is most difficulty, because you are not radiologist, you are not angiologist. For most of you, you are not gynecologist, you are not urologist. So maybe you have we see so many specialties they use really ultrasound without any problem. Why we will be the last one to use in our daily practice? So it's my very important thing that we need to create more science and to see how it works for fillers you inject below the skin for your patient.
So what do you think will be the future in this specific area?
For the future, for me, you know, I'm derm. Probably for future in the field of aesthetic is intelligence artificial, probably, but not to check the face where you have to inject, because I believe that doctor can do it without the help of intelligence, and we have to have a tailored handmade. But for me, it's interesting to develop at IMCAS in all this field the imaging, dermoscopy, OCT, LCOCT, on ultrasound, very high ultrasound, on classic ultrasound. So to see where we want to go for the future, to put some more science where we want, what we want to inject. And I encourage also whole laboratory to propose in our clinical trials a follow-up with ecography. It will be very sustainable and very, very interesting for the future. So imaging, the third eye.
How would you define the Congress in one word?
Enthusiastic is the right one. Yes, you know, when I travel the world to create my own Congress, because I'm a scientific director, and the first thing I see, the smile on the face of the doctor. And we see that doctors are happy to be here. It's the most important, that you have no pressure here. They are happy to be here. So enthusiasm, passion is most my right word, passion.
Thank you for all your answers. And thank you to all of you for your attention.